So good afternoon, greetings from Indonesia. First of all, I would like to thank APMDD for providing the opportunity to share some views regarding our struggles to access public services during pandemic. So what I present to you is actually a briefing paper by Solidaritas Perempuan and Aksi based on our desk review about the women's situations during the COVID-19 pandemic. So we are witnessing that our health system collapse and access to health services is increasingly difficult. We see people were rejected from the hospital because there were insufficient bed and rooms. The alternative is to be self-isolated at home. But the death toll of people during self-isolation is increasing because of reason like lack of oxygen supply that also increasing more expensive, increasing prices for needed medicine, lack of nutritious food because they have a decreased income, lack of informations, and lack of health services coming to their houses. Many times, the whole members of family are infected because not all houses have more than one rooms, one bedroom, and so because of their poor situations. Some hospitals also reported overwhelmed, and it makes these situations women have difficulties or they're afraid to go to hospitals. Particularly pregnant women are facing difficulties accessing health services according to various informations. Health checks for health services for pregnant women or women who are about to give birth must be preceded by a COVID test procedures, which cost them a lot because they have to pay for that. Many times they have to wait in long queue and spend a long time for the result. There was even a case in Mataram, for example, about a pregnant woman who miscarried during the long queue and because she cannot pay the COVID test when she wants to check the health of her pregnancy. The collapse of the health system and a priority to handle the COVID-19 pandemic triggers negligence of other health issues, including reproductive health of women. So the COVID-19 pandemic has increased the health risk of women. And then the gender blind responses measure have strengthened gender injustices, particularly against the poor women. The situation of the pandemic also increased domestic workload of women. The gender role in the society obliged women to do the care work regardless of which conditions they are in. The lockdown adds, for example, to women domestic work. Other additional burden is they have to provide time to teach their children at home. Sadly, cases of violence against women and children are increasing, as reported by the National Commission of Women's Rights and other legal organizations. So frustration and stress due to decreased income because of layoff, loss of livelihood, and other economic difficulties because of the pandemic. And then on the other hand, the response measure, which is gender blind, are considered as the main causes of increasing violence against women and children. We also pay up specific attention to the climate disaster because during pandemic, there is also climate disaster or pandemic during climate disaster, or during disaster, there is a climate issues. So this also exacerbates the vulnerability of women, for women living in the area of disaster-prone places. And the government is not well prepared for a comprehensive handling of annual floods, which is the same times happen with other disasters like the COVID pandemic. So the gender blind response measure, among others, happens because women are not involved in the decision making on the response measure. For examples, about 80% of the Indonesian health workers are women, doctors, nurses, or midwife, but they are not there when the patriarchs dominated governments and health system develop the response measure. So then that's a brief situation of what we see with the women in Indonesia from some cities. And now please the next slides about our struggles. So therefore, looking at these situations, gender just public services during pandemic is our agenda. So some points that we put in our briefer to call for the governments is to ensure access to health services for women in public health services. Why we call it particularly for public services? Because the neoliberal agenda push for privatization of health services and also increasing the number of expensive hospitals. And many poor women cannot access the private hospitals. Therefore, it is important that the public hospitals, public health services also change. And then fast services for the fulfillment of nutrition for children, elderly, and pregnant women through mobile community clinics. And we also have the informations that many cities shift their gender budget, particularly for the welfare of women and children for the pandemic. We call that those budgets must not be shifted. The state budget, the city budget for the welfare of women and children have to be always available. And then also provide social assistance tailored to the specific needs of women during extraordinary events such as a disaster or pandemic. During the COVID pandemic, we see there's a lot of water needed, but the price of water is high because of the privatization. So then the state, the governments, the city have to ensure access to water that fit for consumption for all people, especially in the poor urban areas. Also accelerating service for victims of domestic violence, ID cards, because without ID cards, people won't get any support, and reproductive health in an integrated manner through a family learning center program and educational mobile gender corner for services closer to the communities. So the government also have to develop strategies to support the climate disasters. For example, to respond, not to support, to respond to the climate disaster, like special tent for pregnant women, nursing women, children, and elderly, and in ensuring the implementation of the health protocols during the pandemic in the climate crisis. And it's also important to define women climate vulnerability to climate impacts during pandemics. Though there are some of our call to the government based on our findings due to the situations of the COVID in Indonesia.